So the next component that I did want to talk about this morning was this issue of modeling as learning tools for teams and communities. I mean, much of what I'm doing here is I'm trying to, so there's all different viewpoints and sort of ways of framing system science out there. And many of them are extremely useful. Profound respect for many of my colleagues who speak in this area. I know Ross has been here recently, Ross Hammond, if I'm not mistaken. He was in Melbourne not so long ago, not long after the time I was in Sydney, I think. And Ross is just one of those people I just think the world of. He's great. But people have different views about what modeling is, how it's used, and the role it plays. And I wanted to be sure to present a sort of an understanding from my perspective, because it's reflected in a lot of what we do in terms of the models that we're building up. And although philosophy can be off-putting, I think it's useful to trot out. And another component here has to do with this relationship of how models relate to the human theater of public health, and of healthcare as well. How they relate to stakeholders and how they relate to communities. Because again, there's certain sort of archetypes or certain stereotypes would be better word for it, that people have in mind about how modeling gets used. And one of the big dominant ones is modeling, again, is a back office activity. It's something that nerds like me go, we turn off the lights and we work and we code things up and we give some graph to you and say, this is what's going to happen. You say, oh man, what does that mean? It doesn't even have a label on the axis. And there's some reasons for that historically, that's a meme that's going around. But broadly, I'd like to talk about three modeling eras. This is an extremely important point, particularly with regards to the software we're going to be using. So in the first modeling era, which included much work up through the 70s and 80s, and even to some degree now still operates in certain zones, there was sort of this view, consult us, we'll bring you the answer. You come to us, we're going to build a model of your situation, and we will tell you what the answer is. And deliver it to you, perhaps as a report and graphs, and you should go off and be thankful that such bright people are working on your problem. Very generalist modelers, one day they're simulating a railroad system, the next day they're simulating a hospital, the next day, the ships in the port of Sydney, and the next day they're off to solving the problems of chlamydia in inner Australia, in the outback. The second era of modeling I view as kind of models were built and distributed as black boxes. The models were built by experts, and they were given to you. And you could interact with them, but they were typically black boxes. You would run them, and you could run a certain number of scenarios, which was great. You didn't need to depend on these geeks to do it for you. But you had to operate within what they permitted as far as your running. You had limited end user understanding of the assumptions of these models. You couldn't, often the end users weren't fully sure what was in there. I have some colleagues at Public Health Agency of Canada who for years were working with a model to involve physical activity and diodes, extensive microsimulation models. They were very excited about it. And then one day they learned that the physical activity module was about 10 times simpler and in their view more primitive than they thought. I mean, it assumes that. It assumes that? You're telling all these years it's been assuming that? They were not so happy about that discovery because they've been putting a lot of weight in the decision making that was informed by that model result. And here, often you have slow and outside your organization model evolution. You're paying someone else to evolve that. Okay, well, could you please evolve that? Is there any way you could stick that in by next week? or by next month or by next year. It's a very, these are the high priests deigning to bring you, like Prometheus, this model that you can use. And this is still very much going on. But increasingly what I see, the real hope here, is for what I like to term agile modeling, or collaborative adaptive modeling. And the idea here is that, look, modeling goes on in an embedded way within interdisciplinary teams. This is not to say there are no people trained in modeling. Modeling, like biostatistics or like epidemiology, requires training to be a real virtuoso at it. But the modeling here is embedded in a team context. It's embedded as part of a milieu that involves multiple people interacting with the model and understanding many elements of the model, inspecting the model, spotting issues with the model, and helping to refine it. So the sort of key advance here is the model is relatively transparent to non-modelers, so they can help spot the inconsistencies with their experience, spot the inconsistencies with they know about how the system actually works rather than works in theory, etc. And here, increasingly, we like to see end user customized outputs. They can choose what to display, and the end users have to evolve the model assumptions. And the view here is model is a living document. It's evolving with the learning. It's not something you put your faith in as a black box, that you think some smart people built it who have lots of knowledge and surely they did a good job with it, but rather it's something that evolves with your understanding, the team's learning, both due to interaction with the model and outside the model. So I noted models as thinking tools, and this is really where modeling, I think, is going. And it is going by virtue of demand into lower risk associated with these earlier components. And it is for this reason, ladies and gentlemen, that we in this room will be using this package AnyLogic, because it is a package which permits models to be much more transparent than any other package that I know. So that model we looked at when we first called it up, buzzing, blooming, confusion, lots of things going on, but you could kind of see a lot of things that were in there. You could see that, okay, there was some sort of pregnancy state, and there were sort of two glycemia-related states within that, and then there was this divisions among weight status. There was a lot of transparency there that would have been absent if I had handed you 20 pages of Java code and said, here's the model, which was the state of the art, 10 years ago for agent-based modeling. Fortunately, some traditions, like system dynamics tradition, this is already a reality that you can have a lot of transparency now with existing artifacts. And with discrete event modeling, much of it is gained. But with agent-based modeling, this has been a real barrier to crack. And I think AnyLogic, to its credit, has been the first tool which does it. Okay, so I'd like to talk just a little bit about the implications of this, and this fact that it's often our mental models that are the foremost artifact that come out of the modeling process. We think about modeling as a technical challenge often, and then what comes out is the model. It's the model we're going to use. It's the one model to rule them all, perhaps. And there's a problem there. But more than that, I think it's unrealistic. Often it's the modeling process itself. Having gone through modeling, having those meetings where we're asking, how does this really work? Do we really know that? You're telling me that that's just the pro forma process, and that actually what happens is different than that? With how that area of the hospital actually prioritizes patients? Often it's that sort of turning to consider what's known, what's not known, what is well established, what's still up in the air, what does the literature say about these issues. It's that process more so than the model that offers the greatest benefit. So even if that model were to disappear, it disappears due to bit rot or other purpose or other causes, you've still often secured a great deal of benefit from it. I've talked about modeling as theory building, and it allows us to reflect on our mental models and different perspectives on the system. So within our work, this is kind of an extensive emphasis that we've placed within our work, this sort of embedded modeling. And I'm very pleased to say, particularly with Jeff's involvement and some more recent work, we've done a lot of work with these sort of any logic models that we'll be building that's really been towards group model building, or at least group model adaptation and critiquing. Very, very valuable for building a model that's robust, building a model where multiple sorts of knowledge have been incorporated in the model, and building a model which actually gets used. Jeff talks about wanting to build useful models that get used. Not just useful models that stand on a shelf, sit on a shelf, or get gawked at, but models that actually get put into place. Get results that are put into policy, results that catalyze decisions. And to help enhance that chance, it is very valuable to have a team engaged in it. And this may seem like a real disjunction from what you know is possible with models as these very puzzling artifacts. The reflection, though, and this is something to which I have to credit my colleague Peter Hovmand of Washington University at St. Louis, is that models can serve as an extremely effective facilitator of interdisciplinary interaction by serving as what Peter calls boundary objects. Now, when I first heard that term, I didn't know what it meant. It actually took me several years to really fully unpack what he means by that. But fundamentally, a boundary object is a component that can serve as a common reference point by people from different backgrounds. And the sort of a common shared point of understanding. So if you have people in the same room who are from diverse backgrounds, operations research, epidemiology, public health, clinical medicine, health administration, etc. You put them in the same room, they're going to speak different jargons. They're going to speak different languages. Just wait until the computer scientists come in. Man, if you want to see a clash, the level of the density of acronyms in medicine is almost without equal. And one of the exceptions, I think, is computer science. We can equally acronym the best of them out there. And you put people like that into a room, and it's hard to have a conversation up front that makes sense. But if you can have a common thing that you can point at and talk about and say, this part of the process in the form of a model, often it can facilitate that discussion. It can facilitate going a little bit beyond that jargon. And it actually eases communication. Peter's book, which I'd recommend to anyone, Peter Hovmand's book on modeling with communities, is a great example of how he's used this very successfully, from high schools to community-based groups in urban St. Louis to international forays in India, Mongolia. But the key point is that if a model is rendered in a transparent, accessible way, it can actually facilitate communication. It's not merely that it doesn't get in the way of it, it actually facilitates it. And the modeling approach in software, it's used kind of a major impact on the capacity to do it. So System Dynamics, to its credit, has long put a great emphasis on the human theater of modeling, of bringing people together around a model, of starting the building of a model in a team context. And partly because of that, it's invested very heavily on graphical representations to serve as boundary objects. And causal loop diagrams and stock and flow diagrams can be very useful to understand. So this is an example from System Dynamics. Many of you, how many people in here have seen causal loop diagrams like this? Okay. They are extremely effective at communicating very early in the modeling process, and you can actually get community members, if the facilitation is done well, you can get community members contributing to diagrams like this within an hour of first engaging with them to explain this sort of construct. And similarly with stock and flow models, system dynamics has long provided a visual depiction of models that can get people talking, that can allow the clinician to say, I think you really need another category here, in the middle here in terms of weight or in terms of history of gestational diabetes or what have you, those with long-term history versus short-term history. It can allow for people to critique it, to modify this. This is diabetes sort of diagnosis and progression model. Now, in the agent-based modeling area, this has been a longer-term sort of evolution, but increasingly, and AnyLogic in particular, does support this focus on what is being modeled and less on the how. And the goal here is to get the programmer out of the loop. We don't need another hero. We don't need another programmer, as the bottleneck in our team. Right now, there's a lot of bottlenecks occur in the fact that one of the people is responsible for adding things to the model, and increasingly what we seek in our work and in tool building and in our workflows is to allow any number of different people on the team to be inspecting the model, modify it, evolve it, add scenarios, etc. Okay, I'm not going to go into this, but suffice it to say the software we're using, if you look here, it provides a very visual way of depicting model function. And so, I'll just flip through a couple more pictures, but what's notable is with a bit of care, and it does take some care, this doesn't happen by accident, you can create a model that has visual layout that it can be very meaningful. You can use color and other depictions to help capture commonalities or differences between areas of the model. And the type of representation, such as state charts provided within this package, really enable a depiction of processes in a way that is parsable by those who are not modelers themselves and perhaps have only recently encountered this. This from work with spread of chronic wasting disease, this with patient flow and ED weights from some work one of my students did a couple years back, this from end-stage renal disease and diabetes. You notice dialysis modalities, transplants, different levels of time since transplant, these modalities that are being on the waiting list and undergoing workups, and whether you're active or deferred on the waiting list because of some underlying condition, such as a transient flu or what have you. And you can have a couple of state charts here. Discrete event modeling has long been somewhat visual in its depiction, and we'll be making use of this in next week more than this week, but we'll get to see this. Okay, I think within AnyLogic, just a few comments here. We're going to be taking real advantage of its graphical character. You saw some elements of it already. You saw that, for example, we can depict the population visually. This is not eye candy. It's easy for those, particularly from hardcore engineering or other quantitative background, to dismiss this as just fun and games. It's not. It's absolutely key to spot inconsistencies in the model, spot things that are puzzling, to communicate with stakeholders, to help debug the model. And so within these models, we can associate visually, for example, a person with certain characteristics. So when you click on that person, you can see those characteristics, or you can zoom down and see their full context. We'll be adding things like networks, which again have a visual representation to link people up, and we'll capture aspects of spatial layout, say within a community or within a GIS region, that will give us clues as to really what's going on. Great example of this came actually with this particular model, where for a long time we had operated with an aggregate system dynamics model of this phenomenon. And as part of a student project, this is a project for one of my classes, a student team created this model. This is for chronic wasting disease, and these are individual deer. You don't have deer in Australia, do you? You have roos. Yeah, yeah. They're kind of like our roos, except they're not as cute and they don't have a pouch. But they can be cute. I mean, Bambi, okay. Okay, let's not go there. But fundamentally, we have this model simulates deer and their interactions, and unfortunately, because of the import of some elk from the States, there's a prion-based disease. These disease of these misfolded proteins called chronic wasting disease introduced into Canada. And now it's been spreading within our deer population, and it has possible adverse human effects, risk of Creutzfeldt-Jakob type diseases, for example. And these deer wander over the landscape and they shed prion. They shed prion. If an infected deer defecates, the prion can spread there. If it dies, its carcass can spread prion into the environment. And that prion contamination can last for upwards of 10 years and can infect other deer. So it's like a hazardous waste site around the deers, where the deer defecated and where it died. And so we were simulating this, and we had an aggregate model depicting the whole area where we had an average level of prion. And I saw this graph after about 5 minutes of running the model, and I say, it's not about the averages. It's not about your average level of prion over the space that's going to affect the deer's chance. It's about where that prion is being deposited. It's being deposited where the deer go to drink, where the deer go to eat. Those are the areas that the deer congregate, the deer get exposed to way higher than the average levels. It's not about the averages. It's the tail that wags the dog. It's that lake periphery regions and so on. And that came out of just a few minutes of running this model. Models that capture spatial emergence, spatial patterns, can be very, very useful. I don't think I'll go into this. So why have stakeholders involved in one? Why not build it in the back office, give great recommendations, and exist purely in that relationship? Well, your model's going to be less grounded. It's going to have less good understanding of the system if you're not talking with people in the trenches. You're not going to build the community capacity to make the changes that may be recommended. You're going to miss the opportunity for people to critique model behavior. If you have a non-transparent model, a model that's captured in code or captured in a way that isn't accessible, it will lose that opportunity for all sorts of insight. A model that is transparent can foster stakeholder cooperation, can help make sure that the policy recommendations go further towards likelihood of implementation. A model like this can aid in replanning, aid in community as things don't go according to plan. What should we do now? And the community can help keep the model updated, and at some level might be able to empower community self-guidance. Peter also speaks about, quoting the work of a European philosopher whose name I'm forgetting. He talks about giving the dignity of risk to the community. Look, if they're the folks who are going to be the ones inheriting the consequences of model decisions, why not give them a voice at the table? Give them a stake in the game. Give them a sense of ownership, right? It'll foster, chance it's put into practice will foster better model, but it also is right because it's affecting their lives. So Peter engages in a lot of group model building work, traditionally using system dynamics, but increasingly using agent-based modeling as well. And this is an enterprise with Ross Hammond and myself, to which we've contributed. Now recently, Jeff and Joe here have also been quite active in helping to try out group model building within the context of agent-based modeling. So this notion of community engagement, of participatory modeling, group model building, whatever you want to call it, while it's traditionally been practiced most in the system dynamics community, it's common to any of these traditions that you can engage in it, and it is extremely important, in my view, for achieving the goals of many modeling projects. Okay, modeling in communities. Any questions about that or comments?